Good day everyone, I am an Oxandrolone. I am using my generic name as of the moment and I have brand names which are Anavar and Oxandrine. This is my chemical name. I am classified as a hormonal agent, stimulant, or replacement modifiers in therapeutic drug classifications, while in pharmacologic drug classifications, I am an androgen or an anabolic steroid. In pregnancy category, I am categorized in category X. In my mechanism of action, I interact with androgen receptors in target tissues. I also facilitate skeletal muscle protein synthesis by directly stimulating testosterone and dihydrotestosterone receptors. I also increase androgen receptor expression in skeletal muscles and intracellular amino acid recycling. Receptor binding results in gene expression regulation. In my pharmacokinetics, I am absorbed by administering orally only, and I am distributed by a percentage of 94 to 97% plasma protein binding. I am metabolized in the liver by hydroxylation and sulfation, and as for my excretion, approximately 28% of oral dose are secreted unchanged. Metabolites and excretion of parent drug primarily occurs in urine as unconjugated products.
Oxandrolone is mainly indicated to promote weight gain after weight loss following extensive surgery, chronic infections, or severe trauma. It is also used to correct protein catabolism associated with extended administrations of corticosteroids. Pregnancy, because it can cause harm to the unborn baby, causing birth defects, fetotoxicity, or embryotoxicity. Oxandrolone can stimulate the growth of cancerous tissues in the body, so that's why it is contraindicated to patients with prostate cancer or breast cancer. Oxandrolone is contraindicated to patients with known renal diseases because it can lead to edema caused by sodium retention. Lastly, in our list, Oxandrolone is contraindicated to patients with diabetes because upon taking this medication, it can result to hypoglycemia or low blood sugar. It also inhibits the metabolism of oral anti-diabetic agents. So what are the side effects or adverse effects of taking Oxandrolone? So let's start with the cardiovascular system. Oxandrolone is associated with compromised heart pumping and other heart diseases. In this system, side effects are nausea, vomiting, and kidney damages. In the endocrine system and lymphatic system, ankle swelling, edema, decreased glucose tolerance, increased creatinine excretion are common side effects upon administration of Oxandrolone. The side and adverse effects to the nervous system are anxiety, depression, increased hunger, trouble sleeping, and snoring. For the integumentary system, oily skin, hirsutism, hair loss, acne, and changes in skin color are the common side effects of Oxandrolone. The adverse effects to the skeletal system are premature closure of epiphysis in children. And now for the reproductive system. The common side and adverse effects to male is frequent erection of the penis, and for female, there will be changes in their menstrual period. Now, what would be the responsibilities of the nurse? Let's find out. Assess for mentioned cautions and contraindications, such as drug allergy, pregnancy category, lactation, CV diseases, etc., to prevent any untoward complications. The nurse should perform a thorough physical assessment, such as skin assessment, mental status, abdominal examination, etc., in order to establish baseline data before drug therapy begins and to determine its effectiveness, and to evaluate for occurrence of any adverse effects associated with drug therapy. Here are some of the nursing diagnoses that can be formulated in the use of this drug for therapy. First, disturbed body image related to systemic effects, and acute pain related to GI or CNS effects. In this phase, the nurse should monitor the blood glucose levels for loss of glycemic control and should provide thorough patient teaching to enhance patient knowledge about drug therapy and to promote compliance with the drug regimen. Here are aspects of care that should be evaluated to determine effectiveness of drug therapy. First, monitor patient response to therapy, such as increase in hematocrit and protein anabolism. Second, monitor for adverse effects, such as androgenic effects, serum electrolyte disturbances, epiphyseal closure, hepatic dysfunction, etc. Third, evaluate patient understanding on drug therapy by asking patient to name the drug, its indication, and adverse effects to watch for.
So that's all in our requirement for NUCM 106 Pharmacology. Thank you for watching our report about the autobiography of Oxandrolone. I am Jed Cesar Valenzona as the
I am
drug.
Christian Kid C. Nelmida as the nurse.
And once again,
Once
we
again,
thank
thanks
you.
for watching.